Nothing works for everyone, unfortunately, but I would say, especially if you use a combination approach, if you look at hormones, if you look at, just sort of general health, if you look at, and then you do some injections, maybe with stem cells or with PRP, and then you add in maybe shockwave therapy or a laser or something like that, then the success rate is really high. Probably at least 80% of people will have improvements in sexual function, whether, pleasure, arousal, sensitivity, things like that. So it's not, unfortunately, there's nothing that works for everyone yet, but we have a lot of good tools out there. And I think that that's important because in the past, especially for women, they just didn't know that they could ask for help. Like they didn't know that there was actually help out there if things weren't working, well in the sex department. They just kind of like, I guess this is just how it is. But we actually have a lot of cool tools out there that can be helpful for kind of reversing some of the signs of, the problems that go with aging.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. Did you know that orgasms make women more creative? Birth control pills and wearing certain types of high heels can decrease libido, but being well hydrated and sitting in certain types of chairs can increase libido. But there's much more to sexual health and pleasure, and it can get more complex as we age. So I wanted to ask my guest today to dive deeper on this subject. My guest today is Dr. Amy Killen. Board certified in emergency medicine, Dr. Killen switched gears to focus on anti-aging and regenerative medicine. She has done extensive training in anti-aging medicine, aesthetics, platelet-rich plasma, stem cells, bioidentical hormones, nutrition, and sexual health. She sees patients at Docere Medical in Park City, Utah, with Dr. Harry Adelson, providing cutting-edge regenerative medicine treatments. Today, we talk about best practices for Kegels, as well as PRP, stem cells, exosomes, and other ways to defy signs of aging and improve your sexual health. This and much more on today's episode of the Woman's Doctor podcast.
Okay, so any best practices when it comes to Kegels? Like, is there a right way to do them, wrong way to do them?
The main thing that you want to do is you want to relax. Like if you think about your pelvic floor as being a bowl, but then you if you were to take that bowl and make it taller, you have your abdominal muscles, you have your obliques, you have your back muscles, and then the top of that bowl is your diaphragm. And so you actually want all of these other muscles to be totally relaxed when you tighten up your pelvic floor. And the tightening is kind of like that when stopping your urine is kind of, that's a tightening sensation. But if you don't have relaxation of all those other muscles, then you're not going to get the same benefits. So that's the main thing. And then making sure you're breathing through your nose the whole time and not clenching up everything is also important.
Okay. And does it matter if you're sitting, lying down, standing, any position?
I think it's easiest to learn, just sitting or lying down. But once you get it, once you actually know where your pelvic floor is and you can relax everything else, then you can start to do Kegels, other ways. You can do them in bridge pose or in squats or, in between workouts at the gym. But you want to practice at least when you're in a relaxed state so that you're not tensing up all those other muscles.
Yeah. I mean, I think of any time that I'm waiting, like sitting in my car in traffic or standing in a line or when I'm working out, when I'm doing like my, different exercise, I'm like, okay, well, I'll work that while I'm kind of like resting in between.
Yeah.
I don't know. That's just my personal thing, but
I hope everyone out there is doing their Kegels right now.
Why not? You're just listening to us. So, okay, perfect. So let's talk about stem cells. And you do this thing called an O shot. So tell everybody what that is and what stem cells are.
And so stem cells are the cells in your body that are responsible for the upkeep and repair of all the tissues and organs in your body. And you have different types of stem cells everywhere, your skin, your hair, your muscles, your heart, everywhere. And what happens is as we get older, our stem cells become less active. So they're just less active in repairing and regenerating, so that if we have an injury or if we get sick, things don't get repaired as quickly. And I see this in my kids. My 12-year-old just cut his forehead, and it took like 2 days to heal. Whereas if it had been me that cut my forehead, I would be like 2 weeks out and still, working on that, like healing. And it's because, he's got 12-year-old stem cells. So that's really good. So what we do with the therapies, like the injections into the vagina and clitoris, like the O shot, as it's called, is we use things to activate your own stem cells so that we can start to encourage healing and repair and blood flow and things in that area. So we can use different things. We can use platelet-rich plasma, which comes from your own blood, and it's just centrifuge blood. We can use these stem cells from the patient, from somewhere else, like their bone marrow or their fat, or we can use exosomes, which are like growth factors from placental stem cells. So there's different things we can use, but all of them have the same goal, which is to activate your own stem cells in that area to become more active.
Okay, great. And what do you notice with doing this procedure? Like what are people coming in to see you for it? And what do they tell you afterwards?
So a lot of women will have just decreased sensitivity, decreased pleasure, and maybe it's age related or hormone related or whatever else, but they just notice that things are not feeling like they used to. Some women will have stress urinary incontinence, where they're having a little bit of urine leakage when they cough or sneeze or run, which is very common. Those are some of the most common things. And so I'm injecting into the G-spot area, which is like anterior vaginal wall. And I'm also injecting into the clitoris directly using numbing cream. So it's not as bad as it sounds. And then over time, usually 2 or 3 months, we start to see improved sensitivity, improved pleasure, improved symptoms of stress urinary incontinence if it wasn't too bad to begin with. And then it, usually lasts a year or so, depending on kind of how bad the problem was.
Okay. And you do a series of treatments or just with one?
Oftentimes we'll do more than one, but it depends on the person. Usually I'll give it a couple of months and see how they respond. And then, if they had kind of a partial response and want to have a little bit more, or didn't really have a response, then we can certainly repeat the procedure. It's very easy. It's very safe. And it's just a matter of, getting your body to repair itself, which it can take 1 time or 2 times or 3 times. It's pretty variable that way.
Awesome. And, this docu-series is on women's health and women's hormones. But we can't, it's hard to have sex unless we have a partner.
True.
Right? I mean, otherwise it's called masturbation. Right? But you also work with men because, women might be optimizing their hormones and optimizing, doing O shots and things like that. And they're ready to go, but their partner's not, or their partner, like all of a sudden can't keep up with them, or they're both trying to do things. So what do you offer men? Just so women know, because women are oftentimes the one that like say, hey, honey, come on. Like, I think you need to let's go in together.
Well, just like with women, we do hormones for men. So testosterone is the most common one for men over the age of 40. So we can replace that. We also can do injections with, stem cells and PRP and exosomes into the penis and to help with blood flow and sensation, just like with women. And then we can also do low intensity shockwave therapy with men, or Gainswave is one of the main companies that kind of promotes that. But it's essentially using high intensity sound waves to kind of trigger a healing response in the penis. And that's a series of treatments over the course of about 3 weeks, but it works really well in about 75 to 80% of men to increase blood flow, increase erections, being able to keep erections longer, things like that.
Okay. Okay, great. And so you do the P shot and all of that with men, so you can, take care of men too.
Exactly.
Okay, great. So we, and I know that you've had a lot of success with this too.
Yeah, it doesn't work for everyone. Nothing works for everyone, unfortunately. But I would say, especially if you use a combination approach, if you look at hormones, if you look at, just sort of general health, if you look at, and then you do some injections, maybe with stem cells or with PRP, and then you add in maybe shockwave therapy or a laser or something like that, then the success rate is really high. Probably at least 80% of people will have improvements in sexual function, whether, pleasure, arousal, sensitivity, things like that. So it's not Unfortunately, there's nothing that works for everyone yet, but we have a lot of good tools out there. And I think that that's important because in the past, especially for women, they just didn't know that they could ask for help. Like they didn't know that there was actually help out there if things weren't working, well in the sex department. They just kind of like, I guess it's just how it is. But we actually have a lot of cool tools out there that can be helpful for kind of reversing some of the signs of, the problems that go with aging.
Yeah, absolutely. Okay, great. So what age range for men and women are these kinds of treatments good for?
Most of my patients are between about 30, 35, up and beyond. Like I have patients in their 70s. So, but really the 30s, 40s, 50s are people who are very common in my practice.
I mean, would you say that there is a point where it's too late for someone? I mean, if you had somebody in their 80s or 90s, would that still?
It depends on, I have patients in their 80s who I've treated, who have had great results with some of these things. So it depends on the health of the patient. I don't think that any of these things are going to help someone who's not healthy to begin with. Sure. So you really have to establish that foundation of health first with your diet and your exercise and your sleep and your stress and all of those things before we can start adding, sort of newer, crazier therapies on top of it. Because the foundational health is obviously going to be key.
Okay. And I mean, I think it's interesting to think about that because we are living longer and we want our quality of life to keep up with that. So if, 80 is now 60, the like people that used to feel like they were 60 are now like 80, or people are feeling like they're 60s. Like, it's going to change.
Yeah, I don't think there's any reason. People always ask me because I do a lot of bioidentical hormones in my practice, and they're always like, well, when should you stop taking these hormones? Like, what's the oldest you should stop taking them? And I was like, there's not really a hard cutoff. Like you can kind of, it depends on your doctor, but like I am going to be on bioidentical hormones until the day I die. I haven't started them yet, but when I do, I will continue to stay on them unless there's a reason to stop. Because I want to keep feeling good, right? Like I don't want to just stop one day and be like, I think I'm done feeling good.
Right. Absolutely. Okay. All right. So you have another tool in your tool belt, which is vaginal red light therapy. So tell us about that.
So that's kind of a fun, it's actually a wellness device. So it's not a medical device, but there's a wellness device called VFit, which I'm not associated with them at all, but they have a intravaginal red light therapy device. So if you follow kind of any of the wellness or biohacker trends, red light therapy is very popular for all kinds of things, for improving skin health, for increasing energy production in your cells, applying it to your body. But now we can do that intravaginally with this device that you just kind of put inside for about 12 minutes at a time. And it's warm and it kind of vibrates a little bit. It's like a hot stone massage for your vagina. It's actually just fabulous. And you do it a few times a week, but it can help to increase blood flow and sensitivity. And it can even help with stress urinary incontinence symptoms. So it's kind of a nice, easy to do at home. You can order it yourself online device for just encouraging blood flow to that area.
Okay, great. So there are different things. We covered a lot then. There are certain things you can do with your, of course, lifestyle, which we haven't talked as much about. Well, we talk a lot about in the docuseries, but you mentioned staying healthy overall, taking care of your body.
Yes.
We've talked about things that you can do at home, like Kegels, and also devices that you can use like the red light therapy. There's just a side question about that. The one for your face is different? Yeah. Or do you have like a different attachment for your face?
No, they're different. I have the one for my face is like a panel. And then I have multiple devices around my house. It's crazy. So I have like big panels. I have ones that wrap around my face, but I have some I just stand in front of like naked while I blow my hair dry. But then the one that goes inside of you is designed specifically to go inside.
Okay. Just want to be clear on that. So we got all these devices. I can't imagine what your home looks like.
Yeah. I'll have to have you over sometime. Yeah.
Okay. So you got the devices, things you can do at home, and then there are procedures. So people can kind of pick wherever they are. You can start, with free and simple and what you do at home, and then, try different devices. What is it like if people want to come and see you or someone else that does O shots? What should they be looking for, expecting, when they're looking for a provider to do this procedure?
So the O shot itself is specifically a trademark procedure by Dr. Runnels, who came up with it years ago. I kind of do a variation of the O shot. I don't call it the O shot because of trademark stuff, but basically you're just want someone who's done a lot of these, who seems like they understand women's health, not just someone who can just put a needle in something, right? Like you want to have someone who understands all the other things that go into sexual health and sexual pleasure. But basically the procedure itself is very simple, which is topical numbing cream that is put on for 10, 20 minutes, and then 2 or 3 injections with a very small needle. It's pretty comfortable, and there's not any real downtime afterwards. So it's not a big deal, but you just want to, you don't want to jump just straight to the O shot. I think it's important to look at other things also, like look at the hormones, the lifestyle, all the things you just mentioned. Because if those are not where they need to be, doing the O shot is not going to really be that helpful. So, having a doctor who can talk you through some of the other things is also important.
And people do fly in to see you into Utah in your Salt Lake City and your Park City practices, right?
Yeah, I have 2 practices. The one in Park City is we just do stem cell therapies, and that's the one where I'm taking new patients still. My other practice, I have a whole team of excellent providers that work with me. I don't see patients there, but that's where we do all the hormones. That's where we do, kind of the more integrative approach. And we're taking new patients, but currently have to see you in person at least the first time.
Right. Okay, great. And what is the general cost of an O shot? What does that typically cost?
If you're doing it just with platelet-rich plasma, with your blood, I think depending on where you are in the U.S., it's probably between about $1,000 and $1,500. Some places are more expensive than other places, and then if you start adding in, stem cells or exosomes or things that are more expensive, then the price goes up quite a bit.
Right. And did we cover exosomes?
I mentioned them briefly. I didn't really go into them though.
Okay. So quickly, how would you describe exosomes, and when would someone want to add that in?
So exosomes are the kind of the part of the stem cell that is kind of the action arm of a stem cell. So when a stem cell communicates with other cells, one way it does this is by releasing these little tiny bubbles full of information. They're little baby bubbles, and those will float along, and then another cell will take in that exosome or that bubble, and that will change how that other cell behaves, because it has like growth factors, but it also has messenger RNA for making proteins. So exosomes, the ones that we get, are from placental stem cells. So newborn babies, donated tissue, and the placental cells are then donated, and you have amniotic fluid and cells, and that's where the exosomes come from. So you're not getting any live stem cells from this placenta, but you're getting just the growth factor pieces.
Okay, great. And this is safe and effective. There's research on all of this, right?
There's research on the stem cells and the PRP. The exosome research is mostly in animals yet. So right now we mostly use exosomes for just topical application. So for skin, for hair, places like that. Certainly there's a ton of research being done on exosomes for other things, injecting them, putting them IV. But right now the bulk of the research is in animals. So we're still being cautious with those things.
Sure. Okay. And I had you do, I went in to see you a while back and had exosome,
microneedling.
Yeah, the microneedling. And so we did a PRP and exosomes for my face.
Yes.
So I know we're talking about lady parts, but I mean, our skin is an organ. So can you explain what that's all about?
Yeah. So I mean,
you could go in and do both.
Exactly. So that's what a lot of my patients will come in and do both, because they're like, while I'm here, so I can do skin rejuvenation, I could do hair restoration, and I could do the sexual optimization all in one visit using some of the same kinds of tools. So using PRP, like you mentioned, for your face, the exosomes we can apply topically after doing the microneedling, which is what you did. Of course, you always have such good skin. So those are just ways, again, to activate your own stem cells to increase collagen and hyaluronic acid and elastin, all these things in our skin that start to decrease after about the age of 25 or so.
Mm-hmm. Yeah. And it also helps with acne scarring as well, too.
Yeah, it can help with acne scarring. It can help with hyperpigmentation, so like sunspots. It can help with, just, irregular looking skin, texture, tone, color, things like that. These therapies don't help as much with volume. So like if you've lost volume in your cheeks, a lot of us do as we get older, then these things are not as good for that. And it's not going to be a facelift. So it's not like you're all of a sudden going to have like super tight skin, but it's a great way to increase the health of your skin, sort of in a very natural way. You're never going to look crazy from it. And it's just promoting healthy skin.
Yeah. And when I came in to see, I wasn't really particularly having an issue. I just wanted to try it out because I have, had you on my podcast talking about it, so I wanted to actually experience it. But what I noticed is that my skin was so smooth and so healthy, like you were talking about. I mean, it was, again, it wasn't like I was particularly having issues, but I did notice like little fine lines and things like that seemed to tighten up. And people were like, wow, you're glowing, and particularly glowing. So that's what I noticed personally. Well, this has been fascinating, Amy. Is there anything that we forgot to talk about today? Anything else you want to add in?
We covered the main stuff. I mean, there's always more, but I think we covered the main stuff.
Yeah. So I think for people, where is a good place to start? Where should they start?
I mean, I think you always want to start with basic health practices, and then maybe find a physician that you can work with if you want to go beyond that and start looking at sort of other approaches to maximizing sexual potential. But start with self-examination, making sure that you know your own body, healthy practices, and then you can start adding in tools after that.
Okay, awesome. Thank you so much, Amy. And just as a side note, I think your Instagram feed is so much fun. So you guys should check out Amy on Dr. Amy Killen on Instagram, because she's always has like fun little clips and videos. And I mentioned to my team today that I was getting ready to do this interview. And one of my team members like, I love Dr. Killen's Instagram, and her stuff pops up. And it's so entertaining, and she's so cute. So, and informative. So
well, thank you. That's it. Yeah. Dr. Amy B. Killen, come follow me on Instagram. I would love to have you guys.
Okay. Thanks, Amy, for coming on and sharing your wisdom.
Thank you.
Thank you for listening to the Woman's Doctor podcast. If you enjoyed the podcast, be sure to share it with the women in your life. And to learn all about balancing hormones, join us for the Hormones, Health, and Harmony docuseries at thewomansdoctor.com.